from the American Academy of Pediatrics.
Concussions are scary and sadly pretty common in children. Today, we're diving into what you need to know as a parent or caregiver.
We talk a lot about how we use the analogy of thinking about your brain energy as the battery on a cell phone or a tablet. Everybody knows we want to be at 100%. And that's what kids are usually all the time, is at 100%.
Yeah.
And then after concussion, if they're lower than 100% and they do an activity, they get even lower.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho-Sanchez. I am a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions, and the answers will hopefully be even better. Let's get started. Today, we have with us Dr. Tina Master, who is a pediatrician who specializes in brain injury with a certificate of additional qualification in sports medicine. She's here to tell us what we need to know as parents when it comes to concussions. Tina, welcome.
Thanks so much for having me.
We're so happy to have you. Tina, to start at the beginning, and people are familiar with concussions because of life experiences and them being covered so much in the media, but really, what is a concussion?
That's a great question and not a bad one at all. Just like you said, these are all good questions. Our understanding of what a concussion is has really changed over the years, but really the best way to think about it is that you can have an experience where there is a force, whether it's directly a blow to the head or a force that is a blow to the body or any kind of movement actually that causes your head and neck to move. But really more importantly, what happens is that there's a force that gets delivered to your brain. What's interesting is that we know that the brain doesn't slosh in your skull. So we want to get away from that idea of sloshing because that would be a problem. What probably happens more is that when it experiences that force and you move back and forth, your brain deforms like Jell-O in a Jell-O mold. It twists and it turns, but nothing breaks. And so I think from that standpoint, we don't see any bleeding. We don't see necessarily any bruising or anything on an MRI or a CT scan, which is why those aren't usually a part of the diagnosis of concussion, although sometimes they can be. Really what happens is that the cells, the neurons stretch, and that stretches the injury that's related to a concussion.
Yeah. So, Tina, as I'm hearing you talk, my anxious mom brain and my pediatrician brain is thinking of so many ways that this could happen to children. But I wonder if you can tell us a little bit about the most common ways that children end up with a concussion.
Yeah, the most common ways generally are still probably falling in a hard fashion and hitting your head on something, whether it's the ground, another child, an object, but it's not always resulting in a concussion. So that's where the difficulty lies, is that you can fall and hit your head and you might have a concussion, but you also might not have a concussion. And that's where the dilemma really lies in terms of sorting this out. And this is what's really challenging for families. And so on the one hand, while we want to raise awareness that hitting your head can result in a concussion, it's also possible that it doesn't result in a concussion. So it doesn't mean you have to have full-blown panic whenever your child falls and hits their head. The other most common way would be in a situation where you have a force where your head just moves really quickly, forwards and backwards, side to side, at an angle. And the most common scenario that people might think of might be in a motor vehicle crash where you have a whiplash kind of movement. And that whiplash movement, again, if you have a hard break, you may have a movement, but that's not enough to cause a concussion because it's a small force that's transmitted to your body and your head and your brain. But if you're an actual crash where you have a really big movement where your head and neck and everything moves in such a fashion that sufficient force is delivered to your brain to cause a concussion, then that's what we're thinking about. And so again, those two scenarios where there's a direct injury and impact to the head, and then also then the indirect force, both of those scenarios can cause a concussion. And so falls and anything that gives you a whiplash kind of motion would be the two most common ways where kids would get a concussion.
Yeah, and that makes, a lot of intuitive sense as you're talking through it and just knowing daily life and what our kids are up to. But how can we tell? What are the most common symptoms of a concussion, Tina?
Yes, definitely. And so the most common symptom that everybody will think of first is headache. And then the hard thing about headache is that, as you know, that term's really nonspecific. If
Yeah.
you were to hit your head directly on a door or fall on the floor and hit your head, you might have pain in your head just in the location where you hit it. You might even have a bump there or a bruise. That doesn't necessarily mean you have a concussion. You might, but you might not. Generally speaking, the headache characteristic of a concussion seems to be not just localized where you hit your head, but seems to be more global in nature. It's an all over kind of headache, and it usually seems to be more severe also than a headache that you might have if you just had head pain, for instance, from hitting your head. And so headache is very common. That said, usually it's not the lone symptom. So it's not just that you have a headache. Oftentimes you will have other symptoms like dizziness, and that's another common symptom that will happen pretty soon after the injury. You can also have other thinking complaints. So feeling tired or foggy is another complaint that we'll hear from kids. And then actually visual complaints are common as well, whether it's blurry vision, double vision, trouble focusing with your vision. And so that actually led to the AAP wanting to make sure that we raise that awareness. And so a policy statement was issued a few years ago that we put together trying to highlight the fact that vision issues after concussion are often not recognized by either the kids or the clinicians that are taking care of them or their parents. And so being aware of that's really important. But headache, dizziness, fogginess, feeling tired, and then visual issues are probably the most common. Nausea is also thrown in there as well. And to be honest, when you think about nausea, everybody thinks about vomiting. And the interesting thing about vomiting is that if you have vomiting, you do want to think about a more significant brain injury potentially, especially if it's getting worse. And then what we also have noticed is that vomiting is probably more common in the younger kids than it is in the older kids. Kids across this age range will complain of nausea, but vomiting is a little bit more unusual in the older kids, whereas more common in the younger kids with concussion. And so anytime there's vomiting, you want to at least think about the potential red flags and make sure we're excluding anything more serious than a concussion, because that's always the first job too. When you hit your head, you want to make sure concussions actually may be the least of your problems. You want to make sure you don't have a more serious problem than a concussion. And then once you've excluded the more serious problems, then you can focus on the concussion.
Yeah. And, that gets at also what I wanted to ask you. And it's, what are dangerous symptoms? I mean, it sounds like these are symptoms that come on over time, right? The headache, the visual complaints. But what are symptoms that to you, Tina, are dangerous?
Those are exactly the red flag symptoms that we do want our families to be aware of. And that usually has a combination of factors that you want to take into account. And this is where you'd want to contact and reach out to your pediatrician or potentially seek care in an emergency department would be if you had a really substantial injury. So first we look at the force. If it was something more than just a simple fall while playing, either a recreational activity or sport, for instance, like a motor vehicle crash, where it's a very, very high energy mechanism of injury and you hit your head, you'd want to make sure you take that into consideration. And then on top of that, what you'd want to look at would be, is the headache very, very severe and getting worse? And really the main quality I think that we want to focus on here is that if anything is really severely, rapidly getting worse and changing, that's where you want to seek care. And so severe headache that's getting worse by the moment. If you have severe vomiting that's really repetitive and unremitting, not really pausing or improving or taking a break, but really ongoing. And then changes in really awareness, so real confusion, obviously loss of consciousness, or even feeling the parent having the sense that the child is going in and out of consciousness, or very confused, or repeating questions and not clear on where they are. And so those are the kinds of things where we want to make sure we look at those red flag scenarios and seek immediate care, because while those could be associated with a concussion, you want to make sure that they're not associated with a more moderate or severe traumatic brain injury. And so that's
Absolutely.
a great question, because that's always the first area of concern before we land on the concussion question.
Absolutely. And hopefully parents are hearing those, and those would be reasons to go straight to the emergency room and do so in a really timely fashion. Now, I do wonder, Tina, and I want to be very clear with my next question, because it is really not a replacement for calling a pediatrician and it's not direct medical advice. But for a parent whose child just hit their head, they're not exhibiting the symptoms that you just told us, right? They're not having the red flag symptoms. They're still pretty with it. They're not vomiting, but they just hit their head. What are some ways that they can decide if they need to rush to the ER to be evaluated for a concussion versus if they can wait to maybe call the pediatrician and be seen in the next couple of days?
Yes, I think that's really a relevant question to everybody. Every parent that's listening, this will be a relevant question. And so I think even with all of the advances in what we've learned about brain injury and concussion, et cetera, common sense still does prevail, and so I think that parents don't need to doubt themselves. I think if they hit their head and they seem to be fine, it's okay to observe for a period of time. And so that's the other thing that parents can realize is still a friend to them, having a little bit of time and seeing how things evolve. Certainly, concussion symptoms do get worse, over those first few hours, but they can be, again, in a range where they're not alarming, right? And so if the headache's a little bit worse, if there's a little bit worse fatigue or dizziness or complaints along those lines, they might get worse over those next couple of hours, but that's okay as long as they're not alarming in terms of really having a change in their mental status or really having a high level of extreme, symptomatology and change in those symptoms. And so we definitely would recommend observing. And quite frankly, even in the case of going to the emergency room, observation is still one of those tools in the toolkit that the emergency room physicians will use because we want to make sure we don't expose kids to unnecessary radiation with head CTs if they don't need it. And so there's been some great research done by our pediatric emergency medicine colleagues that have indicated that even if there are some concerning symptoms, there is a role for observation even in those settings so that not everybody has to get a head CT, even if you do have some concerning symptoms. So just so parents know, they have a little bit of leeway there and a little cushion where if your child falls and hits their head and has some symptoms, it is okay to observe for a little bit if they don't seem to be too severe and they don't seem to be progressing too rapidly to see what happens before making the decision about going to the ER or not.
Yeah, I love that. That's so helpful, Tina. And of course, never wrong to call your pediatrician and say, this just happened. This is what I'm observing. What are your thoughts? What can I do? And most practices, mine included, right, have a way to get a hold of us even after hours, which, many things seem to happen after hours. So
always
never wrong to give us a call. Tina, I do want to give parents a sense of what happens when they do bring their kids in to be evaluated for concussions. Like, what should they expect? What are doctors going to do? What is sort of standard testing that happens? Walk us through that a little bit.
Yes. And I love talking about this because I can often reference what the parents' experience was potentially with concussion when they were young and how it's different now and hopefully continuing to get better and better in terms of our ability to diagnose and help support and manage and help kids get better from concussion. And so typically speaking, most of us as parents, when we were children, the experience with concussion was that the doctor often looked at you and said, I don't know if you have a concussion or not because your physical exam is normal. But you're telling me all the symptoms that we would expect to see with a concussion. So I maybe think you have a concussion, but I'm not really sure. And so what we would tell our parents now is that when you bring your child to see your pediatrician for a concussion, hopefully there's a little bit more to it than that now because we've learned a lot more. And so typically speaking, if you come for an evaluation for concussion, your pediatrician will ask a little bit about what happened with the injury, because that is going to be really important. We want to make sure that the injury mechanism seems to go along with having a concussion and that this isn't something else. Because, as you can imagine, this time of year in the winter, you could have a headache because you have strep throat or the flu.
Of course.
And maybe you bumped your head also, right? Because kids are bumping their heads all the time. So we want to make sure that we're not missing something else, that this is actually related to the concussion. And so they'll ask about the injury to make sure that it makes sense that that was the cause. Usually they'll ask about the timing. When did the symptoms start? Did it really start right after or soon thereafter? Because if it happens where you hit your head and then a few days later you have symptoms, is that related to the concussion or is that something else altogether? Then they'll probably ask you specifically about the symptoms. Specifically, we do know the symptoms of headache, dizzy, nausea, And then visual symptoms, light sensitivity, hearing sensitivity, feeling slow, all of those things are associated with concussion. And what seems to be the case is that these symptoms tend to cluster, that they don't happen just singly, but that we have a little group of symptoms that seem to go along with concussion. And it can be from that list of symptoms that we just discussed. And so they'll ask about that. Hopefully you're seeing your pediatrician, and your pediatrician will know about your history. So sometimes there can be other conditions that a concussion can interact with. So if you have attention issues, or if you have learning issues, or if you have anxiety or depression or mood issues, they'll want to be aware of that. And if you have a concussion, how those might potentially interact. And then they actually will do a physical exam. And so back in the day when many of the parents were young, there really wasn't much that they found on an exam because it was a standard neurological exam. Now we know that if pediatricians and physicians do a focused visiovestibular examination that assesses visual function in the form of eye movements and also some vestibular function in terms of potentially triggering some motion sensitivity with some other maneuvers, they may be able to help support the diagnosis of concussion by doing those visiovestibular exam maneuvers. And so they may check balance, where they'll have the child walk also. And so those are the combination of things that they may do on the exam, in addition to the usual listening to your heart and lungs and also doing a general neurologic exam as well.
There's so much now that we can do, Tina, right? In addition to, as you mentioned, the standard quote unquote physical exam, there are now these maneuvers that we can do to try to elicit some of these symptoms, so to speak, which are supportive or go along with a diagnosis of a concussion. So say, Tina, that you brought your child in, they were diagnosed with a concussion. Now what? What's the treatment? What are we going to do?
That is the big question, isn't it? Absolutely. And so maybe not quite the $1 million question, but close. It feels that way at the time.
Yes.
Right? I think what ends up happening with concussion is that it can be very bewildering, both for the child as well as the family. And so that's really where the pediatrician's role is so critical and so important and very helpful, I think, for families to get them on the right track and demystify the whole process so it's not so frightening or so scary. So I think one of the things that we talk about a lot in the office is that basically the concussion headache is not really like any other headache you maybe have experienced before as a child. And it really is an energy headache. And so once we've realized that this is what a concussion is and help our patients and families understand that, that actually helps with how they manage it. And so that's really helpful to realize that normally a child is going to have loads of brain energy. And so then that's why they're having, parents have trouble keeping up with them. They have so much brain energy. And so after concussion, you have low brain energy, and that's a weird situation. Weird for a child because they may have never experienced that before. And now how do they manage that? And so what we like to talk about then afterwards is that the number one homework that we have our kids and families do is try not to hit your head again anytime soon. Right. And so that's where
pretty good.
You can make, a bad situation worse by, adding on. And so we don't want to do anything that's risky. So no high risk sports activities or recreational activities, really trying to keep it low key and really not too demanding. The idea then that we have families think about in terms of moving forward, besides not hitting their head again, with this energy headache that they have, having low brain energy, is that your brain does 3 categories of work, really. So you do physical work, which is walking around, running, potentially sports. And so that's why there's sometimes a little bit of a low key limiting that temporarily. There's also thinking work. So school, homework, thinking, and other activities, reading, are thinking work that your brain does. And then there's emotional work that your brain does, which is basically managing your feelings, how to not get upset at your friend for taking your toy or your sister for being annoying. And so those are the 3 things that your brain does for work on a daily basis. And when you have low brain energy after concussion, you don't have as much energy to do that work. And so the initial job that we have our families do is try and limit that, try and have all of those activities be very low key to give the brain a chance to recover that brain energy. And so that's the whole idea that emerged of having some rest. And so taking it easy for a couple of days. And so the first couple of days, it is good to actually limit all of those things, whether it's school or physical activity, to the level that doesn't really make your symptoms a lot worse. And so that's the first couple of days to manage that brain energy issue. After those first couple of days, you can gradually start to increase your activities along those lines. And that can include getting back to some physical activity, some school activity, but then modified. The key adjective there is modified, that you don't go from a couple of days of taking it easy to then going back to everything. You have to gradually go back. And so that's the key piece. And that gradually going back usually means taking a lot more breaks than you normally would. Normally, kids can get through their day without any breaks at all, whether it's the school day or it's a day at home in the weekend with the family. But then after a concussion, usually what happens and is helpful is because of this brain energy deficit that's recovering gradually, they're going to go through activities in short little bursts with lots of breaks.
Yeah. Tina, I am thinking as you're talking how important the guidance and partnership with the schools becomes, right? Because of that gradual return to activities. And I'm also loving the way that you're framing all the kinds of work really that our brains do. So it's, for parents and for kids themselves, they understand to sort of wrap their minds around all the things that they're doing and all the areas that are going to be needing to rest. So super helpful. Tina, I guess my next question is, what should we expect long term, right? Like I'm imagining, and I've seen this in my own practice, that it can vary a little bit from child to child. But in general, what can we expect long term? How well do kids recover?
What we have learned and what we know from the last decade or so of concussion research is that most kids will get better within that 2 to 4 week time frame. Again, we used to think in the generation of parents right now that maybe you were better in a day or two, right? And so while there may still be some kids who have a mild enough injury where they're better within a day or two, by and large, what we know now is that most kids who have a concussion will be in that 2 to 4 week time frame. And so then that sets the stage so that no one is in a panic or overly worried as these symptoms, again, take a little bit of time to go away and recover, and the body takes the whole process of recovery over that time frame. And so what I would say is that typically speaking, you'll see some improvement over the first week of those symptoms, and then gradually they get lower and lower. The brain energy gets higher and higher, and then kids will spontaneously on their own, without a lot more active management, get better on their own in that 2 to 4 week time frame. What we do know is that if we do a little bit of active management, they can actually potentially get better a little bit more quickly. And what's nice about that is that, even though we haven't gotten, the magic pill that we can prescribe that gets everybody better in a couple of weeks, there are some really straightforward, easy ways that parents and families and schools and teachers and coaches and everybody that comes into contact with kids can support them in getting better in that first 2 to 4 weeks. And they include that those pacing breaks because the brain energy is low. And then getting back into school and activities, though. We don't want kids out of school and activities for too long. The research seems to have shown that the sweet spot really appears to be in that 2 to 3 day time frame, that if we can get kids back into their normal settings, but with adjustments and modifications, that's the best thing. Not having them, with their friends in school and with their normal activities seems to be worse than getting them back to those normal settings, just with a lot of support and a lot of adjustments. And so those support and adjustments are taking the breaks, not having too much pressure, letting them be involved to the extent that they can, but not having them overdo it and exceed their brain energy and then trigger bad symptoms with severe headache or severe dizziness or other issues. And so again, that active management ends up giving them that time and that space to recover and let their brain energy get back to where they need it to be. And so we talk a lot about how we use the analogy of thinking about your brain energy as the battery on a cell phone or a tablet. Everybody knows we want to be at 100%. And that's what kids are usually all the time, is at 100%.
Yeah.
And then after concussion, if they're lower than 100% and they do an activity, they get even lower. And so the critical piece is we don't want to end up at 0 on our battery.
Of
and we
course.
want to probably recharge our battery at around 20 to 30%. And if we can do that regular recharging more frequently than we normally would, we can keep that brain battery in a good space.
Yeah, so helpful. And Tina, I think that's the point in my experience that very often gets lost, right? That we don't want kids out of their activities, but we do need to preserve and allow healing so that that active management, that going back, but with adjustments, that gradual return becomes so key. Tina, this has been so helpful. We like to end every episode with what we call a parenting prescription. So when it comes to concussions, what is one thing that you want all parents to remember?
That is so excellent. I love that you end the podcast that way, because I think that is so helpful, because you want to have that little pearl that you can take.
Yeah.
And I think what I would say is that, as you opened the podcast with, concussions are a very common injury in childhood. So you probably will see and experience one in your parenting career for sure. But don't be afraid of it. That's what I would say, is that, again, it is still a mild form of mild traumatic brain injury. Kids will recover on their own from it by and large. Most kids will. Those kids who have some lingering issues certainly seek out care, and we have ways of actively treating them to get them back to their activities. But again, think about concussion as a brain energy problem and having lower brain energy. And if you can have that approach, I think you'll be able to get them on the right track right away with the support of your pediatrician so they can be on the road to recovery.
Thank you so much, Dr. Tina Master, for joining us today.
Thanks for having me.
And thank you at home for joining us. If you like the Healthy Children podcast, please subscribe on your favorite podcast app and help us spread the word. Follow Healthy Children on YouTube, Instagram, Facebook, and Threads at Healthy Children AAP, and be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Laura Alessio,
Catherine Beard,
Garrett Brown,
Zach Christman,
Ann Johnsos, Kathy Jewell,
Doug Nagel,
Jackie Ortega,
Susan Stevens Martin,
Mary Claire Walsh,
Hannah Weston.
And our theme music was composed by Doug Nagel. We'll be back next week. I'm Dr. Edith Bradshaw Sanchez. Thanks for listening.